Hi, I'm Karnika, health coach and diabetes expert at Besugarfit. Today we will discuss about metabolic syndrome. Metabolic syndrome is not a condition in itself, but is actually a group of 5 risk factors which increase the risk of heart disease, stroke, and diabetes. An increased blood pressure, a high blood sugar level or insulin resistance, having excess amount of fat around the waist, high triglyceride levels, low levels of good cholesterol or HDL, having 3 or more factors results in metabolic syndrome. The thing with metabolic syndrome symptoms and signs is that disorders associated with this are not obvious most of the time. However, apart from the risk factors mentioned before, there are some common symptoms which experts have identified. When an individual has a visibly large waist circumference and it is not reducing despite all efforts. A high blood sugar level which then results in other symptoms like an increase in fatigue, an increase in the number of times you urinate, an increase in thirst and developing a blurry vision. There are quite a few metabolic syndrome risk factors that all individuals should be aware about. An increase in age increases the chances of developing this. The ethnicity of the individual also increases the risk. It is said that Hispanics and especially women are more prone to this. Being obese or obesity increases chances. A family history of type 2 diabetes or getting diabetes during pregnancy like gestational diabetes. Having other diseases like polycystic ovary syndrome, non-alcoholic fatty liver disease and sleep apnea. It is very closely linked to inactivity, obesity, and being overweight. Having insulin resistance also leads to this because the cells stop responding normally to insulin and glucose then cannot enter the cells so easily. Causes the blood sugar levels to rise even though the body churns out more and more insulin in an attempt to lower your blood sugar level. Dealing with how this syndrome can affect daily life would be important from the initial stages itself. Along with any medication given by the doctors for metabolic syndrome treatment, it is equally important to take into consideration other changes and treatment options that might make dealing with this condition and the reduction of its symptoms more sustainably manageable. Maintaining an overall healthy lifestyle and bringing about some positive changes would play a huge role in reducing other complications that may arise as a result of this condition. Physical activity. Make exercise and ample physical activity a regular part of life. Doctors recommend getting at least 30 minutes of exercise, even if it is just brisk walking daily. Increase the quota of daily exercise as you get used to the routine to increase your threshold. Weight loss. Losing around 7% of the total body weight can help in reducing resistance to insulin and can improve blood pressure levels. It also helps to prevent the onset of type 2 diabetes. Any amount of weight loss can prove to be beneficial. Healthy diet. A healthy diet is key to preventing most diseases and maintaining a proper lifestyle. High fiber foods, a protein-rich diet, whole grains, and limiting sweetened foods, alcohol, fat, maida, etc. can be a great approach to deal with the problems associated with metabolic issues. Stopping smoking. Smoking and nicotine should be eliminated to improve overall health and well-being. Manage stress. Engage in activities of self-care, exercise, meditation, yoga, etc. to be able to effectively handle any physical or emotional stress and deal with the symptoms of any conditions or disorders if they arise. For metabolic syndrome diagnosis, A metabolic syndrome doctor will need to perform a certain number of metabolic syndrome tests that will help to detect 3 or more signs of this disorder. The doctor may check one or more of the following for better diagnosis. The circumference of your waist, more than 35 inches for women and 40 inches for men. Your blood triglycerides while fasting. And individuals' cholesterol levels. Their blood pressure 130 by 85 mmHg or higher. The glucose level while fasting 100 mg per dl or higher. If there are abnormalities associated with 3 or more of these tests, then that will help the doctor to confirm the presence of metabolic syndrome in the individual. In the case of the diagnosis of metabolic syndrome, several other complications could arise within the body that can affect the health dramatically. These complications can also be chronic in nature and might take a lot of effort and management to be able to effectively deal with the symptoms. The syndrome gives rise to 2 major conditions. Type 2 diabetes. One of the most common consequences of the development of metabolic syndrome would be type 2 diabetes. If you do not nip the symptoms in the bud when they first arise, it can lead to the development of excess weight and can also lead to the insulin resistance. If this is untreated and occurs frequently, it can lead to a rise in blood sugar levels and eventually developing to type 2 diabetes. Heart and blood vessel disease. As a direct consequence of metabolic related issues, there can be a buildup of higher levels of cholesterol and blood pressure. This can create plaques in the arteries. Owing to the development of plaques, the arteries in the heart can be hardened, leading to heart attack or a stroke. There are no set rules as such for metabolic syndrome prevention, as it does not happen overnight. However, there are some recommended lifestyle changes that an individual can make to ensure they do not develop of any of the 5 risk factors associated with this. Maintain a healthy waist circumference, a healthy blood pressure, a healthy cholesterol levels, regular exercise and weight loss. A diet that is rich in fruits, vegetables, proteins, fiber, vitamins, and the good fats. Maintaining a healthy weight.